The fate of next year's medical school admissions quota remains the center of much dispute as the Yoon administration and the medical arena continue to clash. Our Moon Hye-ryeon starts us off.
With a continued stalemate between the medical community and the government, the Health Ministry is focusing on emergency medical care. Second Vice Health Minister Min-soo, in a briefing on Monday, stated that private doctors with their own practices can now apply to support local hospitals without needing their applications to be approved by the local government, but just directly by the hospitals themselves. The Health Ministry also addressed growing concerns over medical staff shortages following the resignations of medical school professors. The notice period for resignations generally tends to be a month, meaning the mass resignations submitted by medical school professors in solidarity with the junior doctor walkouts would be due to hit this Thursday. The Vice Health Minister explained that owing to contractual details, there is no need for concern yet, and he urged professors to come forward for talks.
There are currently no resignation forms submitted to universities that are due to take effect. Government is doing its best to talk to medical school professors. We ask that they come forth to give their opinions instead of taking collective action.
On Sunday, the deans of 40 medical schools across the country submitted a joint statement demanding that the medical school admissions quota for 2025 be kept as is without any increases. The Korean Medical Association and a group of medical school professors all backed this statement, along with junior doctors taking the stance that no dialogue with the government can take place without the topic of a medical school quota freeze on the table. This comes just 2 days after Prime Minister Han Duck-soo announced that the government will allow each medical school to freely decide the number of students that can enroll for 2025, allowing schools to independently recruit between 50% and 100% of the previously suggested increased quota. As the need for conversation between the two sides grows, a special task force is due to launch on Thursday. The task force, made up of 6 government officials and 20 non-government officials such as experts and representatives from doctors' groups, will discuss pivotal issues in the government's plans for medical reform. But the Korean Medical Association has rejected this call for talks, saying that the purpose and organization of the task force is not concrete and that it feels its opinions will not be heard. Junior doctors, the key personnel who have been staging mass walkouts, have not yet confirmed whether they will be sending representatives to the task force meeting. Even if doctors refuse to participate in the task force meeting this week, the government plans to push ahead with the task force. Moon Hye-ryeon, Arirang News.